Yeah.
I have two questions. The first one is, I agree with you that employment-based health insurance doesn't really make sense, and I don't hear a lot of debate about that. It just seems idiosyncratic. So the first question is, why is that not something that's coming under question, and why is it being reinforced? And then the second question is, coming from a nursing perspective, I'm interested in how the various bills and the versions would affect expanded scope of practice for people who are not doctors.
Not a lot in terms of expanding scope of practice in the bills. A little bit, a couple of experiments, but it's generally limited, and largely because they wanted to keep the AMA on board in terms of endorsing it, and how the AMA is about those things. In terms of why it's not being talked about, I think partly it's because there'll be winners and losers if you move to an individual system as opposed to the employer system, and the losers are two very powerful groups. The two groups that benefit most from employer-provided insurance are Fortune 500 executives and union workers. And so if you have the AFL-CIO and the Fortune 500 Chamber of Commerce both saying keep the system, it's pretty hard to build momentum for changing it.
And why is it in their interest? I mean,
because they've negotiated very rich. They have
Cadillac-style
policies. Their policies cover every possible thing under the sun. They got spa treatments and all that sort of stuff. And they're worth a lot of money. And if the employer gave them started looking at costs, they're not going to give them what the policy is worth, essentially, or they're not going to get the tax break. It's not going to be enough to offset the increased expenditures. Yeah.
How are the private insurance companies right now going to deal with these changes?
Mostly they're going to make you pay more. I mean, they're not. Look, businesses are entirely self-interested. They're not there's no magnanimity there. They're going to. This is going to cost them more to provide more product. You're telling them that now they're going to have to cover people who are sick, and telling them now they're going to have to offer additional benefits. They're just going to jack up the premiums to cover it. And I don't see anything in this bill that's going to knock that down. I mean, I think actually the way the bills are written gives them every encouragement to do so, to raise those premiums. Yeah.
So you don't believe that there are any inefficiencies inherent with our system that could be?
I think there's huge inefficiencies in the healthcare system. I just don't think anybody's figured out how to get rid of them. I'm all for. I think that we for example, the worst inefficiency, the most inefficient healthcare system I can possibly imagine is Medicare. I mean, all the things the president talks about being wrong with the healthcare system are wrong with Medicare. You talk about systems where they have different levels of expenditure on a per capita basis with no difference in outcomes. Spending $3,000 in one state, $10,000 in another state per capita with no significant difference in outcomes. That study actually is a study of Medicare payments, not private insurance payments, that came up with that. Medicare pays you entirely on a piecework basis. The more inputs you put in, the more you get paid. It doesn't matter what your output patient is. In fact, Medicare is one system where if you make the patient sicker, you actually make more money because you get the cat and them come back in the hospital and they get paid again. It's everything you can think of is wrong with it. It's a 1965 Blue Cross Blue Shield policy. It's a system that essentially pays you for routine care. There's a $150 deductible on doctor's visits. So once you use up $150, you can go to the doctor all you want, and you never, you don't have to pay anymore. No co-payments and stuff. So the incentive is go to the doctor every time you have a headache type of thing on this. But if you're actually sick under Medicare, it stops paying you. After 90 days in the hospital, Medicare cuts out. So, it's exactly backwards. It's as if your auto insurance policy paid for your oil change and your fill-up, and if you totaled your car, it wouldn't cover you. So everything, so there's all these inefficiencies, and yet we do nothing about Medicare. Why? Because most people on Medicare are sick, and they want it to cover their doctor's visit, and they vote. And they don't care about the 10% of people who really get sick, because, that's a much smaller vote. So the more you politicize these things, the worse you make the inefficiencies, I think.